Secretary Kagwe has called for synergy among IGAD member states in dealing with challenges posed by emerging health threats. Now, Mutahi was speaking during the 13th IGAD Health Ministerial meeting, where he urged African leaders to think outside the box and develop African solutions to African problems in health matters going forward. Here is Patronila Gorin with the story.
Addressing the press, IGAD Executive Secretary Wakni Gebeyeu said they had agreed on how member states would work together to strengthen the health sector, citing that improving the health system at border points is key in combating health challenges.
We discussed about the area of cooperation, especially in the refugee areas, host communities, and vulnerable population, how to bring the health to the community, especially since one country alone cannot combat the challenge of health.
According to Health Cabinet Secretary Kagwe, cooperation between IGAD member countries has helped the region find solutions to emerging diseases and coping up with the outbreak of various diseases that have been reported in the past.
A disease in one country will inevitably be a disease in all countries. That we have learned from COVID-19 that cooperation is the only way that we can be able to tackle the health challenges that we have ahead of us. That because we expect our people to move freely in our nations, as friendly nations, as African nations, we also know that free movement of people will also resort to sometimes free movement of viruses, bacteria, and so on and so forth. And therefore, we need to tackle the disease burden together.
During the meeting, IGAD partner states signed key policies such as IGAD Regional Health Data Sharing and Protection Policy, Cross-Border Health Policy, Regional Maternal, Infant and Young Child Nutrition Advocacy Strategy, and Regional Knowledge Management Strategy for Health for implementation in member states.
We agreed on the need to set standards so that the standards that we set will be standards across the region rather than only in one country as opposed to another, in a manner that also captures the universal health coverage needs of all nations.
The policies are expected to unlock, catalyze and capitalize on the latent health assets that are already inherent in various populations. The conference was attended by health ministers from Ethiopia, Djibouti, South Sudan, Uganda and Somalia. Patronila Goren for TV 47 in Mombasa County.